Today marks the beginning of American Heart Month. Heart disease is the #1 killer of all Americans. The good news, heart disease is preventable and treatable by knowing your body and staying away from certain risk factors. Wake Up's Kaylee Dion is an advocate in the fight against heart disease. Recently got to complete a screening herself. Kaylee?
Yes, I got the screening, Stephen, because my father was diagnosed with the disease a couple of years ago. If you have family history, it's important to know your numbers. I recently spoke with a cardiologist and found out many times the first time they see a patient in the hospital is with an urgent problem. They usually have some risk factors that hadn't been treated, but it's very easy. Take a look. Heart disease is the leading killer of Americans.
Unfortunately, in many cases, the first time we see a patient in the hospital is with an acute problem, and they have many risk factors that have never been treated or not aggressively treated.
The risk factors for heart disease are smoking, diabetes, high blood pressure, high cholesterol, and premature family history of the disease.
If they're having symptoms such as chest discomfort, shortness of breath, fatigue, to have it evaluated.
And registered nurse at Princeton Baptist Medical Center, Sherry Brazelton, gave me the complete screening, which is free to everyone.
The first thing I'm going to check is your blood pressure. Do you take any medicine for blood pressure? Okay. That's good. But I got 92/60. You've got the blood pressure of a teenager.
Yeah.
This is for the cholesterol. And I have to have enough in this just to go up to all that black line. It won't let me cheat. The next thing that we're going to do, because of the scales that we have, it does require the patient to be barefooted. So.
Oh, that's fine. I can be barefoot.
Okay.
I got a pedicure a couple weeks ago.
Okay. Now, BMI stands for Body Mass Index, and that's just simply a calculation based on your height and your weight. Okay. It puts us in different ranges, and you are within the desirable range. Your BMI is 23. Okay. 20 to 25 is the desirable range for men and women. The next test that we're going to do is called Ankle Brachial Index, or ABI for short. Okay. The reason we check this is because most of the time if someone has poor circulation in their legs, most of the time it can be due to different things, but most of the time it's due to a blockage in their leg arteries, and that's called peripheral vascular disease, or PVD. Now you can hear that. That's just your pulse rate. This machine also allows me to see what your heart rate is, and it's right in the mid-60s, which is perfect. Well, actually, we've got a little bit of work to do on your cholesterol numbers, but I'm going to talk to you about that at the end, okay?
I kind of figured that was going to be the case. Okay. After your screening, the nurse will spend some time explaining what the numbers mean. They will then give your information to a physician. If you don't have a doctor, they will help you to find one so you can start your heart-healthy lifestyle. And the best part, the screening is free. Stephen?
Great advice. Thank you, Kaylee.